Hi, I'm Dr. Mike, and often I'm asked the question, how to manage clients with balance disorders. And one of the first concerns with clients with balance disorders is safety. Now, in many instances, we'll have clients coming to the gym that have these balance issues. Seniors, clients with neurologic disorders, whatever the case is, and they'll come to the gym wearing their classic workout gear. And you can see I'm dressed for a workout. I have on a fleece top, but you'll notice underneath I've got on a pair of workout pants, okay? Now, if I may, Jen, one of the key things in physical therapy settings, when we work with clients with balance disorders, we want to use what's called a gait belt or a leather belt. So for your clients that have neurologic issues, make sure they bring a leather belt on. So what I'm going to do is, I'm going to be the client with the balance disorder. Jen here is going to be the trainer, and I put the belt on. Now normally Jen would do this. I put it on nice and tight. And let's say I have a balance problem. You already know it. You're working on balance activities with me. And while you're working on these balance activities, I lose my balance and I start to fall. Look what happens. Now I weigh about 215, and Jen, how much do you weigh if you don't mind me asking?
110.
About 110. Now she's able to control me, and if there were a chair or something behind me, she could even lower me, if you would lower me down. She could lower me down into the chair and I don't fall and injure myself. But let's do this the second way. Let's take this off, and let's say I'm Jen's client, I'm working in the gym, I have a neurologic disorder, and now I start to lose my balance, but she's holding on to these rather flimsy pants. Now, they're not going to rip, obviously, but look what will happen. She doesn't have any control over me. So now I end up on the floor with possibly a fractured hip or something else. So the key thing is, if you have clients with that you know have balance disorders, use a leather belt or a gait belt. We primarily use gait belts in physical therapy settings, but if we're discharging these clients to the fitness setting, make sure they have a leather belt on. Now, for these clients, instead of having them come to the gym facility in their normal workout gear, think about it. Clients with balance disorders, they aren't probably out running and jogging, so you may want to tell Mr. Smith, the gentleman with the balance disorder, to wear a pair of khakis, a nice thick leather belt when he comes in, and that'll be sufficient in helping you make sure he's nice and safe when you work on balance activities. Please remember this. When you work on balance, you've got to provoke balance, which means you want to actually push the person to the point they lose their balance, which means there are some safety issues there. Make sure they have the leather belt on. You hold that leather belt so if they lose their balance, you have good control over them. So thanks for stopping in, and best wishes in building your post-rehab practice.